Hello, my name is Tatiana Stanilevich. I am a doctor resuscitator and medical expert of Triton Company. Today I will tell you about FiO2 sensor replacement and calibration in intensive care ventilator MV200. Calibration of FiO2 sensor. Calibration of oxygen sensor measuring the concentration in the inspiratory gas FiO2 is used. During maintenance, after replacement of FiO2 sensor, according to the method, check or replace the oxygen sensor during automatic control and calibration of FiO2 sensor, or any cases, particularly if concentration measurement error exceeds 2% during air ventilation. The device has FiO2 electrochemical type sensor. Its lifetime depends on oxygen environment time and oxygen concentration. At medium operation parameters, FiO2 sensor lifetime is more than 1.5 years. Calibration of FiO2 sensor is important in the final phase of the sensor life cycle to extend its lifetime and accuracy. For the calibration of FiO2 sensor, disconnect the device from the patient, press main menu, service menu, calibration, CIVL, FiO2 sensor calibration. Disconnect the breathing circuit. Press to encoder to start the calibration. Sensor calibration takes about 1 minute. Press encoder to continue. After message calibration successfully completed, restart the device and it's ready for operation. If the calibration isn't done, you need to replace the sensor or repair the device. After sensor replacement, calibrate it again. FiO2 sensor replacement. For the replacement of FiO2 oxygen sensor, switch off the device. For this purpose, unscrew the 2 screws of the oxygen sensor cover. Carefully take the inspiratory connector assembly so as not to break off the wires of the connector. Disconnect the sensor power cable. By counterclockwise rotating, unscrew the faulty sensor. Install a new sensor. In some cases, a spy sensor can be included in the delivery kit. Assemble the inspiratory connector in the reverse order. Calibrate the oxygen sensor.